Welcome. Let's look at the brachial plexus. The brachial plexus is also referred to as the plexus brachialis. It is a network of spinal nerves, which is made up of the lower cervical spinal nerves and also the first thoracic spinal nerve. So these nerves will come together to form a network of plexus that is called the brachial plexus. So what are the functions of this brachial plexus? The brachial plexus is responsible for cutaneous innervation of the upper limb and also muscular innervation of the upper limb. And what this means is that we would be able to feel the sense of touch in the upper limb, also the sense of pain. All these will be allowed due to the innervation that the brachial plexus supply. Also, we will be able to move the upper limb, different regions of the upper limb around the joint in the elbow, and also movement of the hand will be allowed through the innervations of the brachial plexus. Brachial plexus will innervate the muscles, and this will cause the muscles to either contract or relax. And as they do so, this will allow the production of movement at joints. So functions of the brachial plexus is for sensation and also movement of the upper limb. So let's go further to see the relations. So what are the relations of the brachial plexus? The brachial plexus is located within the posterior triangle. The posterior triangle is bounded anteriorly by the sternocleidomastoid muscle. This is the sternocleidomastoid muscle. Sternocleidomastoid has 3 points of contact. The upper part is the mastoid process of the temporal bone, and this is the mastoid process of the temporal bone above. This is one insertion point of the sternocleidomastoid muscle. Going to the inferior end of the sternocleidomastoid muscle, we have one insertion point in the anterior part, which is the sternum, and posteriorly we have another insertion part, which is the clavicle, and that is where the name is being generated from, sternum, then mastoid. So this muscle forms the anterior border of the posterior triangle, and posteriorly we have the trapezius. The trapezius is highlighted in blue, and it forms the posterior border of the posterior triangle. So within this space is where we have the posterior triangle, and this is where the brachial plexus is located. The trunk of the brachial plexus is sandwiched between the anterior and the middle scalenus muscle that are located within the posterior triangle. The brachial plexus is also crossed by some structures, and this includes the external jugular vein. This is the external jugular vein that crosses the brachial plexus. We also have the inferior belly of the omohyoid muscle, which is highlighted in red, and this is the inferior belly of the omohyoid muscle. We have a superior belly of the omohyoid muscle in the anterior part, which is located in the anterior triangle. But the inferior belly of the omohyoid muscle crosses the brachial plexus within the posterior triangle. You can go and check up a lecture on the anterior triangle and posterior triangle of the neck. I have done a video on this. You can go and check that up to upgrade your knowledge in this area. The brachial plexus will then be overlined by the deep fascia, the platysma muscle, and also the skin. So those are the structures that are related to the brachial plexus within the posterior triangle of the neck. On the lateral side of the neck is where you see the posterior triangle, and that is where we have the emergence of the brachial plexus, where it runs down to then supply the upper limb. How is the brachial plexus formed? The brachial plexus is formed by the ventral rami of the C5, C6, C7, C8, and also the T1 spinal nerves. So these roots will come together to form a network of plexus that is called the brachial plexus. So if you look at this alignment, we see that we have C8 highlighted. The 8th cervical spinal nerve is highlighted here because if you look at the configuration of the cervical vertebra, we know that we have 7 cervical vertebrae, but we have 8 cervical spinal nerves, which does not correspond to the number of cervical vertebrae that we have. And of course, it's supposed to. And of course, this 8 cervical spinal nerve also contributes to the formation of the brachial plexus. So let's see how the 8th cervical spinal nerve emerges for it to now form a contributory branch that supports the formation of the brachial plexus. So let's look at this. Why 8 cervical spinal nerves when we have cervical vertebra that has 7 in number? If you look at the cervical vertebra, C1, C2, C3, C4, C5, C6, and C7, of course, we have 7 cervical vertebra. And of course, we are supposed to have a corresponding number of cervical spinal nerve, but it does not happen like that. So if you look at the emergence of the spinal nerve from C1 to C7, you see that the corresponding named spinal nerve emerges above the cervical vertebra. Let's take C1 for illustration. If you look at the upper border of the first cervical vertebra, you see the first cervical spinal nerve emerging above the first cervical vertebra, and that is how it occurs down until it gets to the 7th cervical vertebra. The emergence of the 7th cervical spinal nerve, of course, is also above the 7th cervical vertebra. But we need to have the emergence of the 8th cervical spinal nerve, and that emerges below the 7th cervical vertebra. So you have all cervical spinal nerve emerging above the corresponding named cervical vertebra. Then we now have the emergence of the 8th cervical spinal nerve emerging below the 7th cervical vertebra. So the 8th cervical vertebra will emerge between the 7th cervical vertebra and the 1st thoracic vertebra. Then if you look at all this configuration, you see that the spinal nerve from C1 to C4 above do not contribute to the formation of the brachial plexus. While cervical spinal nerves that emerge from C5 to C7, of course, we have the 8th cervical spinal nerve that emerges below the 7th cervical vertebra. Then you have the thoracic spinal nerve from the 1st thoracic vertebra. This is the 8th cervical spinal nerve that emerges below the 7th cervical vertebra. And that is how we have the emergence of 8 cervical spinal nerves when we have 7 cervical vertebra. And all these will then form a network or plexus of nerves that will supply the upper limb to allow sensation to be felt and also to allow movement in the upper limb region. So let's look at how this brachial plexus is formed between the roots that we have highlighted. Before we go into this, let's look at this, which says that remember to drink cold beer. Each of these words will be used to draft the different regions of the brachial plexus and also how they are formed. Let's look at the first region, which is the root. The root is like the origin of the brachial plexus. This will represent the word remember. Then the next word is toe, and toe will form the trunk. The trunk of the brachial plexus is formed by the root, and this is the region of the trunk. This is followed by the letter D, which means drink, and drink represents divisions. And the trunk will further divide into the divisions of the brachial plexus, followed with chord, which represent chords. The divisions will also come together to form the chord of the brachial plexus, and this is the chord of the brachial plexus. Then the last word is bear, and bear represents branches, the branches that emerge from the brachial plexus. So what this means is that one region will lead to the formation of the other region. So let's dive into the root and see what the root entails. We've said that the root is the origin of the brachial plexus, and it is formed from the anterior rami of the spinal nerves, which ranges from C5 to C8 and also T1. That means the root is 5 in number. So we have C5, C6, C7, and C8 cervical spinal nerves, and also the first thoracic spinal nerve. The next region is the trunk. The trunk is formed by the root. So we have 3 trunks, and this is the region of the trunk. We have the superior trunk, we have the middle trunk, and we have the inferior trunk. Let's see how the roots come together to form the trunk. For the superior trunk is formed by the anterior rami of the 5th and the 6th cervical spinal nerves. So these two will come together to form the superior trunk, and this is the superior trunk. While the middle trunk is formed at the continuation of the 7th cervical spinal nerve, and this forms the middle trunk. While the inferior trunk is formed by the union of the 8th cervical spinal nerve and the 1st thoracic spinal nerves. So these two will unite to form the inferior trunk. In totality, we have 3 trunks that are formed from the root of the brachial plexus, and this includes the superior, the middle, and the inferior trunk. So let's go further to see the next region, which is the divisions. The divisions is also formed by the trunk. So let's see how the trunk also forms the divisions of the brachial plexus. The divisions, we have total of 6. On our previous slide, we explained that we have the superior, the middle, and the inferior trunk. So each of these trunk will divide into anterior and posterior divisions. So for the superior trunk, we have anterior division, which is highlighted in blue, and this is the anterior division of the superior trunk. This is the anterior division of the middle trunk, and this is the anterior division of the inferior trunk. So we have each of the trunks dividing into anterior and posterior divisions. So for the posterior divisions, we have the posterior division of the superior trunk. This is the posterior division of the superior trunk, and this is highlighted in red. For the middle trunk, we have also the posterior division, which is highlighted in red. Then for the inferior trunk, we have the posterior division, which is highlighted in red. So all anterior divisions are highlighted in blue, while the posterior divisions are highlighted in red. So each of the trunk will further divide into anterior and posterior divisions, and that is what the divisions entails. So let's move to see what will be presented as we go further. From the division, the next is the cord. So let's see how the cords are formed from the divisions. So after the divisions highlighted in both blue and red, the next region will be the formation of the cord. We have 3 cords. We have the lateral cord, we have the posterior cord, and we have the medial cord. These cords are so named based on their position or their relations with the axillary artery, which is a continuation of the subclavian artery. So let's say this is the axillary artery. For the lateral cord, it means that this cord is formed from the divisions of the brachial plexus and is located lateral to the axillary artery. And this is why this is called the lateral cord, because it is laterally located to the axillary artery. And we have the posterior cord that is posteriorly located to the axillary artery, and this is the posterior cord. Then we have the medial cord. The medial cord, also from the name, it is medially located to the axillary artery. So this is the medial cord that is medially located to the axillary artery. So it is their relation with the axillary artery that is used to establish the name of the cord. But let's see how these cords are formed. For the lateral cord, this is the lateral cord. This lateral cord is formed by the union of the anterior divisions from the superior and the middle trunk. If you look at this trunk, we remember we said that this is the superior trunk, this is the middle trunk, and this is the inferior trunk. So the anterior divisions from the superior trunk and the middle trunk come together to form the lateral cord. So this is the lateral cord that is formed by the union of the 2 anterior divisions from the superior and the middle trunk. Then if you go more posterior to the axillary artery, we have the formation of the posterior cord. And this posterior cord is formed by the union of all the posterior divisions that emerge from the superior, the middle, and the inferior trunk. You can see how interesting this is. And this forms the posterior cord of the brachial plexus that is located posterior to the axillary artery. And this is the posterior cord. And the next is the medial cord. This medial cord is formed by the continuation of anterior division of the inferior trunk. If you look at it, all other divisions have been taken off to form the lateral and the posterior cord. The only branch that is left is the anterior division of the inferior trunk, and this will now continue to become the medial cord. So the medial cord will now be the continuation of the anterior division of the inferior trunk. And this is the medial cord that is formed as a continuation of the anterior division of the inferior trunk. So let's go to the branches. This is like the final region of the brachial plexus, and this is divided into 2. We have the non-terminal branches, which are branches that emerge around the different regions of the brachial plexus. These are branches that we see around the root, around the trunk, and around the cord of the brachial plexus. So we have branches emerging from the different regions of the brachial plexus and also going to supply different structures around the upper limb. So those are the non-terminal branches of the brachial plexus. Then we also have terminal branches, which are the final end branches of the brachial plexus. And those are the branches that are highlighted in black. These are the branches that you see at the end of the brachial plexus. So you can see how we have tried to classify the branches into non-terminal branches and also terminal branches. So we'd like to dive into this to see the different types of branches that emerge from the brachial plexus and also the structures that they innervate and also possibly the action that they exert. So let's go to the non-terminal branches. The first region, of course, of the brachial plexus that we'll be looking into is the root, because that is like the origin of the brachial plexus. We also have a number of branches that emerge from the root of the brachial plexus. So let's look through this to see what they are and also what they innervate. For the root region, we have the emergence of the dorsoscapular nerve, and this is the dorsoscapular nerve. This nerve arises from the ventral ramus of the C5 cervical nerve, and this is where it emerges from. The dorsoscapular nerve supplies the rhomboid muscle and the levator scapulae. The rhomboid muscle extends from the medial border of the scapula, that's this region, to the vertebral bone. So you see it running, helping to hold the scapula in place. And the levator scapulae extending from the superior upper border of the scapula to the upper cervical region. So these two muscles are innervated by the dorsoscapular nerve. Another nerve that emerges from the root of the brachial plexus is the long thoracic nerve. The long thoracic nerve, from the name, it's a long nerve that emerges from the anterior rami of the upper three cervical spinal nerves that constitutes the root of the brachial plexus, and that ranges from C5, C6 to C7. The long thoracic nerve emerges from the C5, C6, and C7 cervical spinal nerve, and it runs down along the thoracic region to supply the serratus anterior muscle. The serratus anterior muscle is seen to run superior laterally on the 1st to the 8th or the 9th ribs in the anterior part of the ribs. And this is the long thoracic nerve that emerges from the anterior rami of the C5, C6, and C7 cervical spinal nerve. So going further on the non-terminal branches of the brachial plexus, the next region would be the trunk. In the trunk region, we have the emergence of the subclavian nerve, and this is the subclavian nerve. The subclavian nerve emerges from the superior trunk of the brachial plexus, and this nerve, from its name, it supplies the subclavius muscle. This is the subclavius muscle. This is the muscle that is seen below the clavicle. Then the next nerve is the emergence of the suprascapular nerve. The suprascapular nerve also emerges from the superior trunk of the brachial plexus, and this is the suprascapular nerve. The suprascapular nerve supplies the supraspinatus and the infraspinatus muscle. This is the posterior part of the scapula. If you look at it, it's divided into a smaller upper region and a bigger lower region by the scapular spine. This is the spine that tends to divide this posterior part of the scapula into two, and the upper part is termed the suprascapular fossa, and the lower part is the infrascapular fossa, just as the name implies. The suprascapular fossa is filled with supraspinatus muscle, while the infrascapular fossa is filled with infraspinatus muscle. So you have the supraspinatus and the infraspinatus muscle at the posterior part of the scapula. So as the suprascapular nerve emerges between the anterior and posterior scalenus muscle in the posterior triangle, it runs downwards and it passes through this notch that is termed the suprascapular notch. So this notch is an indentation that is created for the passage of the suprascapular nerve. So it passes through it before it's now able to get access into the posterior region of the scapula, where it supplies the supraspinatus and the infraspinatus muscle. So you have the suprascapular nerve supplying the supraspinatus and infraspinatus muscle at the posterior part of the scapula, and this is the supraspinatus muscle, and we have the infraspinatus muscle just below it. The subclavian nerve or nerve to the subclavius and also the suprascapular nerve are non-terminal branches that emerge from the trunk of the brachial plexus. And the region where you see them emerging from is the superior trunk of the brachial plexus. So these are the two nerves that emerge from the trunk of the brachial plexus. And specifically the region where they emerge from is the superior trunk of the brachial plexus. So going further on the non-terminal branch, the next region will be the cord. Around the cord region, this is the cord region highlighted in green. Around the cord region, we have the emergence of also a number of branches. But let's start with the lateral cord. In the lateral cord, we have the emergence of the lateral pectoral nerve. This is the lateral pectoral nerve. And this nerve supplies the pectoralis major. The pectoralis major is the muscle that is seen in the chest region. It forms the bulk of the chest, and this muscle is supplied by the lateral pectoral nerve that emerges from the lateral cord of the brachial plexus. Then on the posterior cord, we also have a number of branches that emerge from the posterior cord, and this include the upper and the lower subscapular nerve, which supplies the subscapularis. This is the upper subscapular nerve, and this is the lower subscapular nerve. These two nerves supplies the subscapularis. The subscapularis is a muscle that is seen within the subscapular fossa. If you tilt the scapula to the anterior side, you see that within the anterior region, there's an indentation that is called the subscapular fossa. Within the subscapular fossa is where we have the subscapularis, and this muscle is supplied by the upper and the lower subscapular nerve. Another nerve that emerges from the posterior cord is the thoracodorsal nerve, and this is the thoracodorsal nerve. The thoracodorsal nerve supplies the latissimus dorsi muscle. This is the latissimus dorsi muscle that forms the bulk of the back. Then going to the medial cord. Within the medial cord, we also have the emergence of a number of branches. We have the medial cutaneous nerve of the arm and of the forearm. This is the medial cutaneous nerve of the arm, and this is the medial cutaneous nerve of the forearm. This supplies cutaneous innervation of the arm and the forearm respectively. Then we also have the emergence of the medial pectoral nerve. This is the medial pectoral nerve. Remember, we have the lateral pectoral nerve emerging from the lateral cord at the upper part. So we also have the medial pectoral nerve emerging from the medial cord in the lower part, and this supplies the pectoralis minor. The pectoralis minor is seen below the pectoralis major, and this nerve also supplies a portion of the pectoralis major muscle. So this is how we have the branches seen within the different regions of the brachial plexus, ranging from the root to the trunk, then to the cord. So those are the branches that we have highlighted. Then going to the terminal branches, which are the end branches that emerge from the brachial plexus, and these are highlighted in black. We have 5 of these branches, and going through this mnemonic, it will help us to remember these branches. And this states that my auntie raped my uncle. So we have my, and this is musculocutaneous nerve. This is the musculocutaneous nerve. The musculocutaneous nerve will represent my, and it is a terminal branch that emerges from the lateral cord. Remember, this is our lateral cord, this is the posterior cord, and this is our medial cord. So from the lateral cord, we have the emergence of the musculocutaneous nerve. The next one is the axillary nerve and the radial nerve. The axillary nerve and the radial nerve are emergence from the posterior cord. This is the posterior cord. So we have the final termination. Axillary nerve represents anti, and radial nerve represents raped. This is the axillary nerve, and this is the radial nerve. So the axillary nerve and the radial nerve are seen as the terminal branches of the posterior cord of the brachial plexus. Then going further, we have the median nerve. This is the median nerve, and it represents my. Median nerve is formed from contribution from the lateral cord and the medial cord, and this is how it is formed. We have a lateral root and we have a medial root. The lateral root is supplied by the lateral cord, and we have the medial root supplied by the medial cord. So these two roots will unite to form the median nerve. So you can see how the median nerve emerges from both the lateral cord and also the medial cord. And the last one is the ulnar nerve. The ulnar nerve represents uncle, and it emerges from the medial cord. And this is the ulnar nerve emerging as a terminal branch of the medial cord. So that is how we have the emergence of the terminal branches of the brachial plexus. So let's look at each of these nerves one after the other to see what they supply and also the action that they exhibit. The musculocutaneous nerve, we say it emerges from the lateral cord. This is the musculocutaneous nerve, and it supplies basically the muscles that are seen in the anterior part of the arm. And this includes the coracobrachialis, the brachialis muscle, and also the biceps brachii. This is the coracobrachialis emerging from the coracoid process of the scapula, and it's been inserted on the upper medial surface of the humerus. Then we have the brachialis muscle that emerges from the anterior surface of the humerus and also inserted on the ulnar tuberosity. Then we have the biceps brachii that forms the bulk of the anterior surface of the arm. These three muscles are seen in the anterior part of the arm, and they are being supplied by the musculocutaneous nerve that emerges from the lateral cord of the brachial plexus. These nerves help to control movement of the shoulder joint, also exhibit effect around the elbow. The musculocutaneous nerve is also responsible for cutaneous innervation of the lateral region of the forearm. This is the forearm region. So the cutaneous innervation of the lateral part of the forearm is also being supplied by this musculocutaneous nerve. Then going to the next nerve, the axillary nerve that we say branches from the posterior cord of the brachial plexus. The axillary nerve supplies the deltoid muscle and also the teres minor muscle. This is the deltoid muscle that is a triangular muscle that is seen around the shoulder. It forms the contoured pattern that is seen around the shoulder, and we have the teres minor muscle that extends from the lateral border of the scapula and is inserted into the greater tubercle of the humerus. Also, they supply the cutaneous innervation of the shoulder region. The next nerve is the radial nerve, which also is a branch of the posterior cord, and this is the radial nerve. The radial nerve supplies the extensor muscles of the upper limb, seen in the posterior part of the upper limb, and this includes the triceps muscle. The triceps muscle is seen at the posterior part of the arm. Then we have the brachioradialis. The brachioradialis, this is the brachioradialis, is seen at the lateral part of the forearm. Then we have the supinator. We have the anconeus muscle. The anconeus muscle is seen at the posterior part of the elbow. The extensor carpi radialis longus and brevis are seen in the posterior part of the forearm. The extensor digitorium, it helps to extend the digits. The extensor indices, this helps to extend the index finger. Then the extensor digiti minimi helps to extend the last finger or the smallest finger. We have the extensor carpi ulnaris. We have the abductor pollicis longus. Pollicis is the tongue, so it helps to abduct the tongue. Then we have the extensor pollicis longus and brevis, which helps to extend the tongue. All these muscles are seen at the posterior part of the upper limb and are of course supplied by the radial nerve. Then we have cutaneous innervation of the radial nerve, supplying the posterior lateral part of the arm and also the posterior lateral part of the forearm. It also supplies the dorsolateral part of the hand, which means the posterior part of the arm, but on the lateral side. So these are the innervations of the radial nerve. Then the next one is the median nerve. This is the median nerve. We say that the median nerve is formed from contributory branches from the lateral cord and also the medial cord. So they supplied flexus muscle, which are muscles that are seen mainly in the anterior part of the upper limb. And this includes the flexor carpi radialis, the palmaris longus, which is inserted in the palmar aponeurosis. Then we have the pronator teres. This is the pronator teres that forms the border of the cubital fossa. Then we have the flexor digitorium superficialis, which helps to flex the digit. We have this flexor digitorium profundus, which is the radial half of this muscle. The ulnar half of this muscle will be supplied by the ulnar nerve. Then we have the lumbrical muscle. These are the intrinsic muscles of the hand. Then we have the flexor pollicis longus. The flexor pollicis longus, it helps to flex the thumb. We already said pollicis is thumb. Then we have the pronator quadratus. Then we have the abductor pollicis brevis, the flexor pollicis brevis, and also the opponents pollicis. These three muscles form the tinea muscle. This is the tinea muscle of the hand, and they are supplied by the median nerve. Then we have the median nerve supplying the ventrolateral part of the hand. So this is the ventral part of the hand. Then the lateral part is where the median nerve supply. We already said that the dorsolateral part is supplied by the radial nerve. So the ventrolateral part is supplied by the median nerve. Then the ulnar nerve, which is the last one that emerges from the medial cord, supplies the flexor carpi ulnaris, opponents digiti minimi, the flexor digiti minimi. It also supplies adductor pollicis brevis, which helps to adduct the tongue. Then we have the flexor digitoris profundus, which is the ulnar half, and this is supplied by the ulnar nerve. Then we have the abductor digiti minimi, which helps to abduct the last finger. For the cutaneous innervation of the ulnar nerve, the ulnar nerve supplies the ventral and the dorsal surface of the medial region of the hand. This is the hand in anatomical position, and this is the medial part, and this is the lateral part. We've already said that the dorsolateral part of the hand is supplied by the radial nerve, while the ventrolateral part of the hand is supplied by the median nerve. So the remaining region for cutaneous innervation that is remaining for the hand is the medial region, which includes the ventral surface and the dorsal surface. And these surfaces are supplied by the ulnar nerve. So the ulnar nerve supplies both the ventral surface and the dorsal surface of the medial region of the hand. Let's look at clinical anatomy. Brachial plexus injury. This could be caused by stretching, by diseases, or even impact around the lateral region of the neck where the brachial plexus is located. And this will lead to loss of sensation and also loss of movement of the upper limb. We have Erb's palsy, the paralysis of the arm region. This occurs as a result of injury to the upper part of the brachial plexus, and this includes the upper trunk, which is formed by the C5 and C6 roots. When there is an injury infringing this area, because of the branches that emerge from this area, the supply muscles that are located in the arm region, there's going to be the paralysis of this muscle. And this can occur during childbirth process when the head of the baby is pulled out of the vaginal canal. This can tend to recover on its own. Physical therapy may also help to stimulate healing process, and surgery may be needed depending on the intensity of the injury. So let's look at clump palsy. Clump palsy or paralysis is an injury to the lower region of the brachial plexus, and it involves the paralysis of the forearm and also the hand, because the branches that emerge from this region supply the forearm and the hand region. So any injury to this region will affect the functions of these muscles. And this occur when there's injury specifically to the 8th cervical nerve and also the 1st thoracic nerve. So when there's injury to these two nerves, either before they unite to form the inferior trunk or after they unite to form the inferior trunk, when there's injury to this region, it is going to result in the paralysis of the forearm or the hand region. This, of course, can occur during childbirth, during pulling process. We also have wrist drop. Wrist drop may also be referred to as radial nerve palsy because it's an injury to the radial nerve that causes the wrist to drop. And this occurs when the ribs remain flexed due to loss of action of the extensor muscle. Remember, we talked about the extensor muscle in the posterior part of the upper limb that is supplied by the radial nerve. If the action of this nerve is lost, there's not going to be pulling effect of extension of the wrist. So it's going to cause the dropping of the wrist as a result of injury to the radial nerve. Then it's also good for us to know that we could have a prefixed or a postfixed brachial plexus. When the brachial plexus is prefixed, it means that the roots of the brachial plexus occur before the normal scenario. The normal scenario is for the root to extend from C5 to T1, but when it extends from C4 to C8, it is called a prefix. It means it is formed before the normal scenario. Then we could have a postfixed, which means that it is formed after. Instead of beginning from C5, it will now begin from C6 down to T2. So this kind of presentation is post-phys, and it's good for us to highlight this. Let's look at brachial plexus block. This is a local or regional anesthesia. So when surgery is needed to be performed on the upper limb, the brachial plexus can be used as a means of inducing local anesthesia. So thanks for watching this video. Let's meet again.